With a person with an autoimmune disorder, they are going to be either stuck in a dominant Th1 response or they're going to be stuck in a dominant Th2 response. That's, by definition, what will happen in this person. Most people that have an autoimmune disorder are Th2 dominant. And probably 90% of those people have no idea that they have an autoimmune disorder. Because it's the Th1 dominant autoimmune patients that have the most destruction. Because what is in that slurry of chemokines and cytokines in a Th1 response? Those are all the killer cells. Remember, they're the Marine Corps with machine guns. So if I have a Th1 dominant autoimmune thyroid issue, I'm going to have a lot of symptoms. And I have taken Synthroid, and I can never figure out my dose, and sometimes I have this racing heart, so I think my thyroid's going crazy, and sometimes I can't even get out of bed, I'm so tired. Nobody can fix me, I can't figure this out. Well, you have an autoimmune thyroid issue, most likely Th1 dominant. So somebody asked me before we started, how do you know if you're Th1 or Th2 dominant? Because if you read my book, Help My Body's Killing Me, that's super important to know that. Because there are certain supplements from a nutraceutical perspective that stimulate a Th1 response. And there's certain supplements from a nutraceutical response that stimulate a Th2 response. And if I'm Th1 dominant, Lyme disease or thyroid issues, you don't want to be taking things that are going to stimulate the Th1 response. That person might feel better a little bit to begin with because that cat's claw does start killing the spirochetes, but then it stimulates this Th1 response by itself, and now I feel worse. So typically a person that has the more serious autoimmune disorders and more aggressive autoimmune disorders that have done so many different things, and I've tried every nutraceutical approach, I've tried all these different people's approaches, and I just can't seem to get better, that your biggest hint that that's most likely a Th1 disorder. The Th2 dominant disorders are more insidious. They're less destructive. They're less inflammatory. So those people will just have this chronic inflammatory condition underneath the intimal lining of your arterial vascular system and your heart, and it's causing this blister and this blockage of your artery over 20 years. And so it's very slow and insidious. You don't even notice it until you have a heart attack. But it's still an autoimmune disorder. Cancer is almost always a Th2 dominant disorder. So this person is stuck in this Th2 dominantness by itself. If you're stuck in a Th2 dominant disorder, you're going to have a lower Th1 response. What do you need your Th1 response for? We're going to talk this afternoon. That's what's going to kill cancer cells. So at least at the site of the cancer, cancer is going to be Th2 dominant. Follow me? There are some functional medicine tests that you can run for that too. You have to measure in that slurry of a Th1 response and Th2 response are different types of cytokines. So you can measure those cytokines, and I always recommend 3 tests a couple weeks apart to get an average, a measurement of those cytokines if you're going to diagnose this. You can also do a challenge test. I'm going to take a whole bunch of Th1 stimulants. Does it make me feel worse or better? If it makes me feel better for a long period of time, Th1 stimulants, they're listed in my book, like vitamin C, echinacea, cat's claw, anything that you really think of as an immune booster is really going to be a Th1 stimulant. So take those things that make me feel better. Yeah, it makes me feel tons better for a long period of time. Then if you were autoimmune, you may have been Th2 dominant. Follow me? So with autoimmune disease, if you're going to get that person better, this is just you can throw this out if you want, but my thought is, if we're going to get that person better, we can do things to balance the Th1, Th2 response.